Hi, everyone. Hey, last week I did a Skype call with all the customers, the OptiFast customers in the central region. And we did this topic here, keeping patients engaged in your clinic operational during this pandemic. We got some great feedback. It was a lot of conversation going back and forth, but a lot of you couldn't make it. And I consciously didn't want to record it just because, I thought people might be less engaged if they knew it was being recorded, if they had comments, things like that. But unfortunately, a lot of people, you couldn't make it. So what I wanted to do, my goal here is to go through the slides that we use and just kind of recap what was talked about on the call. So I'm going to run you through these slides, and hopefully this will be useful for you if you weren't on the call. So what we talked about on the call on the 25th of March, it fell into three separate buckets. One was we talked about OptiFast product distribution, how to get our products to your patients if your facility's closed or if patients just are not comfortable coming in to pick up products. So we talked about three or four ideas around that. Then we also talked about how to do patient medical visits and educational visits. We talked a little bit about telehealth and gave some ideas on that. There was a lot of good exchange talking about insurance reimbursement, how that may work for telehealth versus patients coming in. And then finally, we gave some ideas on how to start thinking about getting new patients in the door and how to maybe do that, via telehealth and virtual ideas and how to do it. We really thought there was four different ways that a clinic can get our products to patients if the patient cannot physically come into your clinic, either because they're really during this time they're not comfortable doing that, or your clinic is closed to patients. You don't want them coming in. Regardless, there's some ways to do this that we talked about. There's some good discussion around it. One way was this curbside pickup, and um, that seemed like it's working for a couple different clinics. What that would entail would be the patient would pre-order the products, maybe for the next 2 weeks, or it could be for a little bit shorter duration, a little bit longer. But you would get the order, you would know what they want, you would have them pay for the order, and maybe with a credit card, and then arrange a time when they can come drive to the clinic without coming in, and you can take the order to the patient's car. So maybe one clinic had talked about that they're open to do this like every Thursday, and it's all day Thursday. They're actually closed completely, but they have a staff member that comes in, and that's all she does is fulfill these orders, bag them up, and then take them out curbside when people come by. So you'd probably want to arrange a specific, general time, and then as the patient arrived in the parking lot, they would text or call you, and then someone would just go out, place the order in their car. Another clinic had talked about they would just leave the products right on the curbside, and then the patient could actually kind of get out of the car, take it, as long as it wasn't raining or snowing or something, and put it in their car, in their trunk. But either way, it seems like it's working pretty well. That's probably the quickest and easiest way to do it. Um, Another way is home delivery, from the clinic right to the patient's home. And this would entail arranging with an online account at UPS, FedEx, or USPS, where you have an account, you can actually save a patient's name and address to an address book. So you don't have to keep putting that in over and over again. And you would actually have it set up so those charges would be billed right to you, the shipping charges. So you would get the patient's order just like you did at the curbside pickup. There'd be an order form or through the phone or a patient portal, and the patient would already pay for that would prepay for it via credit card, and then you would just package it up. And what you can do, I know with a lot of these, we learned with FedEx and UPS, I think USPS too, is you can check a box when you're when you're paying for the order online, that the order will become picked up at your clinic. So you would package it up. Someone comes in from UPS and just takes the order. You don't have to do anything with it. You would have to bundle it up depending on what the patient ordered. And what we talked about was doing a flat shipping rate when you do this. So I think what people talked about was doing a $20 flat shipping rate. Now, sometimes it'll cost you a little bit more depending on the weight of the product, if it's a lot of ready to drink, but sometimes it'll be less if it's mostly powder. But $15 to $20 per order seemed like that was a reasonable amount. The actual shipping charge of what you're going to pay is going to be very specific depending on the weight of the order, but it's kind of too difficult to get that specific with every single order and try and bill the patient in advance what that exact shipping amount would be. So we have a number of clinics that are doing this, had set this up for mostly maintenance patients, had already been doing the system, and it seems like it works well. Amita Health is one of them. A third one is something new that we offer through Nestle. It's a home delivery directly from us to your patient's home. Now we have a form, and I can get you this form. It's an Excel spreadsheet, and you would fill this form out. So you'd get the order from the patient, and you would fill this out. You'd put the patient's name and address on this form, and you would submit this form via email. The instructions are on the form directly to us. You would email it in to customer service, and then we get it. We bill you just like we would if an order is coming right to your clinic at your tiered pricing. So that doesn't change, except that it goes to your patient. Now, when we do this, one word of caution, this is for full cases only. So these are the shipping cases that you would get wholesale from us. So the powder, for instance, that's going to come in a big shipping case with 12 smaller cartons of powder of 7 servings each. So they're going to get 84 servings of one particular flavor for the powder. For instance, the ready to drink would be 27 servings of a particular powder. We're not going to break it down further and further. But it's a really, really nice option because in your regular tiered pricing, whatever it is, you're still paying that same amount. There's no other markup. Typically, we would say there's a $5 surcharge for orders under 25 cases. Well, we're waiving that. So this isn't going to last. We're not going to offer this ongoing. But for now, for COVID-19 only, if you had a patient that you need to get products to, you could send this form in. If they wanted, a case of chocolate ready to drink and a case of vanilla and a case of bars, we would ship it out to the patient's home. We'll send you an invoice, same billing that you would do, same price, nothing else changes. The fourth method is using my OptiFast Journey, and that does come with an e-store. There's actually an option of a free e-store that wouldn't cost you anything or very, very little. We'll work out if you're going to mark up products or not, but that's an option too. If you just want to get your patients access to this e-store, you would still set your own pricing, but I'd be happy to walk you through that. But that's a pretty quick and easy way to do it as well. So those are really the 4 options. We did discuss the different types of virtual, patient visits, educational visits, medical visits, because it is really confusing. We started off the discussion by talking about how telemedicine and this virtual care will become the new normal moving forward. In fact, there was an article here, and I'll provide a link in the email to this video showing that. And I think we all agree now that that is going to be the case, that there is going to be more of a role for telemedicine in the future. And if you're going to get started doing telehealth, telemedicine now, when you maybe have some more time because things have slowed down in your clinic, is to start trying to see what works, what doesn't, different platforms and so forth. Um, Dr. Anthony Ariyama was on the call, and he kind of went through for us the difference between telehealth visits, what that means, versus virtual check-ins, which is more brief communications that could easily be on the phone or email, and then e-visits. What is the differences? How are those defined? So I'm not going to go into a lot of details here. There is information out there if you're interested in what the differences are. But we did go through that briefly. We did talk a little bit, and Dr. Ariyama is a consultant with us that's authorized to talk about billing and reimbursement. So he did talk about a little bit about that, and I'll share a little bit of that more on the next slide. So continuing on with the patient virtual visits, we did discuss a little bit about the different platforms that you can use that are available. And there's a bunch of them out there, and we can't make any real specific recommendations. We do see that, think about if you're setting this up, you might as well think about doing something HIPAA compliant. Right now, there's a number of, HIPAA, non-compliant things that you can use because right now the government has really given the okay to do this during this pandemic. So you could use Skype, Facebook Live, things like that. But if you're going to start doing this, you may look at the HIPAA compliant things. Some people we know have access to telehealth through their EHR system. So if you're a hospital and use Epic, that there may be some options there. But for the most part, you don't have that. We do offer something called My OptiFast Journey, and I'd be happy to walk you through what that entails. That is HIPAA compliant. You can do one-on-ones and group sessions for education, telemedicine visits. So that's ready to go. We work with a partner called Virtual Health Partners on that, and we can get you going on that probably in a few weeks. Zoom for Health, we've heard that is something that a couple of our customers are using that is HIPAA compliant. There's secure text messaging if that's what you want. There's something called Connect. We may want to take a look at that. So, kind of play around with the different things. There's different options available. We did talk a little bit about billing with non-HIPAA compliant platforms through the crisis. So Medicaid, Medicare are allowing to do that. Dr. Ariyama did share with us, and I'll give you the link to this document that Amita Health had produced that goes through all the private insurers, what they're currently, what are they covering? How is it different if you're doing something virtually versus if you would do it in person? And a lot of times now the private insurers are stepping in line with what the government has done. There's no difference. But this document has, what's nice is this has some links to it that link to some private insurers web pages that goes over that, and we think that those are staying updated, and this is changing day by day, but they're updating those links. So I'll have a link to that in the email to this video as well. This picture right here, this actually shows My OptiFast Journey, some screenshots of the app and how it would work doing virtual one-on-ones. We went through the different types of virtual visits that you could do to keep patients engaged. And we're talking mostly here educational, but obviously the easiest thing to do with virtual one-on-ones would just be, a phone call with a patient, just checking in. We've heard some success with clinics that have reached out to patients that they haven't heard from in a while. So existing patients, maybe they haven't heard from 6 months. During this pandemic, people are stressed out, just reaching out, how are you doing, anything we can do to help? And they've been able to get patients back involved in treatment. And so just doing, some regular phone calls may be very helpful. Or you could use a video-based platform. You could use something like My OptiFast Journey, but just doing one-on-ones can be helpful. We talked a little bit about virtual groups, and the way to do this for your technology challenge patients, hey, maybe just want to set up an audio only conference call line. So there's some easy ways to do this. There's no technology barriers. Most people know how to call into an audio conference line and do an audio conference group. So, Skype does it, but there's other things. Someone had mentioned freeconferencecall.com, where it's a free service. You could do this. So that could be something that could be immediately implemented and easy to do. Of course, there's the video-based platforms. There's a bunch of them. You have to decide, do I want to do something that's non-HIPAA compliant right now, like Facebook Live or GoToMeeting, versus like Zoom for healthcare, or My OptiFast Journey would be more of a permanent solution versus an immediate thing that you can implement. But it is a great way, I think, having patients being able to see each other and interact with each other. That's what gives you the social support, or gives the patient social support. So for some patients, that may be something they're really craving, especially if they're feeling isolated during this time. Being able to manage and see the staff too just adds more social support. So think about, do I want to do virtual groups as well as just one-on-ones with patients? Here we talked about supplements to groups or one-on-ones. And during this time, we think it's probably prudent to do regularly scheduled outgoing messages. So just keeping patients engaged, especially patients that may be, in maintenance, or you haven't heard from a while, or patients that may be expressing some interest or have in the past of becoming a new patient, of starting, and maybe they've decided, hey, now it's not the time to do this, but really keeping in touch with them. So, doing social media posts, if you have Facebook, Twitter, LinkedIn, is continuing to do posts where the patients see you, see that you're available, you're reaching out to them. A couple of clinics have mentioned that they're just doing emails directly to patients and prospective patients, or even an e-newsletter. We have something at Nestle called IFX News. That's a free service that you can put together a newsletter for your patients. So I'll be happy to talk to you about that. If you have an EHR portal, that can be used. We've heard some things about that. But there's other ideas too. So, maybe doing just a quick, 10-minute podcast every week, update people. Or if you have a blog site, doing some YouTube videos, just things like that, where you're engaging with people, and maybe that prompts them to contact you back. If you're doing some topics like blogs or podcasts or YouTube videos, think about this. If you're creating content, you want to give maybe a topic or talk about embracing change, or whatever it is, nutrition, stress management, some good topics during this time. Think about maybe utilizing our LES modules. There's really good content there that you could kind of repackage in different formats, media formats, like YouTube, podcasts, blogs. So don't hesitate to use our stuff. And you may want to use a combination of all these different things in your outreach to your patients. And if you're going to be doing virtual sessions, particularly group sessions, we recommend that you try and maintain a similar structure to what you would do in person in your clinics. So, if you're going to be doing virtual groups, it's a good idea to think about establishing group rules, just like you would in person. You let people know that they shouldn't be multitasking. If they're on some type of virtual group, we shouldn't hear someone pecking on their keyboard as you're going, muting the background noise. Make sure that they know the correct login information, keeping the start and the end times punctual and on time, we think is important. Start the session with an inspirational or uplifting message. We've heard that can be very helpful to kick things off in a very positive manner, during this time. Should establish a curriculum plan, have an agenda of things during these virtual sessions of what's going to be covered, a topic, week to week, kind of like you would if you're doing these at the clinic, um, and have, a kind of agenda for that session and what kind of support materials you're going to use and so forth. Again, I would really emphasize, use our LES modules. You can get these as PDFs. We can get those to you free of charge. You could forward those on electronically to your patients and maybe attending the group session. This is a couple topics here that we think are really good right now. This first one, embracing change, and then eating to ease stress, are very timely. So think about those as topics to a virtual group session or one-on-one. You may want to think too here about opening patients access to the call early so they can have their kind of pre-group interaction. So maybe you get online and allow them to access the call, 5 or 10 minutes before the regularly scheduled time that you're going to start the session. But as people would do in your clinic, maybe before a session, they're going to be checking in with each other, talking like they would in a waiting room area of your clinic, that type of thing. So just an idea that you may want to think about. And then encourage interaction by requesting each participant share, one thing that they achieved that week, kind of like you would do in person. What are some successes you had that week? What are some obstacles? How did you overcome them? Still try and maintain that interaction. And still follow the same, cognitive behavioral therapy process. Follow up on what happened the week before. Introduce the new topic. So maybe you do this week, you do an embracing change. Facilitate the discussion, and then ask people, what's their plan for the upcoming week? What obstacles do they think they may encounter? How might they deal with them? That type of thing. And yes, use our modules. We've got over 40 topics, great content ideas. Here's some good topics here. How to exercise at home. We don't have a module on that, but there is a lot of good resources out right now. That's what people are interested in. They're saying, hey, I've got more time. I want to exercise. I'm not sure what to do. I know there's personal trainers now that are doing virtual visits. Maybe check out things in your area, or give people some resources for it. It's a great time for them to start doing stuff at home. This last point here, be comfortable having a camera on you. So if you're going to be doing these video visits or group sessions, what we've found is that if the patients can see you, if you become more comfortable with that, that does add a lot. A lot of times with these virtual sessions, you may not be comfortable being on camera, but I think we need to do that, and that's going to become the norm, I think, going forward in the future, is doing the video and patients seeing you. Okay, finally, we talked about new patient enrollment. And at some point, you're going to start thinking about that. How do I get new patients enrolled while we're still in the midst of this pandemic? Some ideas that we discussed on the call. Think about your initial introduction or information session. If someone is interested, how are you going to depart that information if they can't come physically in to sit down with you, talk to you, or attend some type of session? How is that going to work? The easiest thing to do is a one-on-one phone call. And maybe you can send them, a PDF, electronic brochure, but just doing a one-on-one phone visit is probably the quickest, easiest way to do it. Think about, though, about eventually moving to some type of webinar where they can maybe see you or see the staff. They can virtually meet people. They could see your facility, maybe even putting on some type of recording, some patient testimonials. So they just get a good idea of what your staff is like, what you're like, what the facility looks like. So they kind of, they have a real good feel for this. And maybe even consider uploading, if you do something like that, to YouTube or Vimeo or your website, so they have access to that. Think about it as a marketing thing, but you're going into more details on what the treatment involves and what the staff is like, things like that. You could actually take this, if you do some type of video, record something like this, you could add a link to your own social media post. So you're getting that out there and people are looking at that and you're establishing your credibility with people that right now, believe it or not, there are people that are thinking, maybe this is a good time for me to look at weight loss. I'm not going out to eat. I'm not going to graduation parties. And I want to feel like I have some control. I want to do something positive during this time. So, but getting that information out is going to be important. The thing we talked about was offering a total virtual short-term medical weight loss program. So, right now, working with very high-risk patients where there's a big long-term commitment to try and do it virtually. It can be done for some patients, but maybe a lot of patients, that's just going to be too much to think about and getting labs. But right now, could you do something more short term, say in even a little higher calorie, say 12 to 1500 calories, maybe using 4 servings of OptiFast, 1 regular food meal, do it say for 8 weeks. That allow the patient to kind of test the waters, keep the costs lower, and do it all virtually. We're going to have another webinar with Dr. Jamie Ard in a few weeks. We'll talk about medically monitoring people on a totally virtual program and virtually right from the start without, how do you do that without doing a history and physical exam? We just had a webinar a couple days ago with Dr. Robert Ziltzer at Scottsdale. I'll send you a link to the recording of that if you missed it. He addressed that a little bit, but we think just offering something like this might be a good thing to get patients going in your program that maybe otherwise would be difficult for you or them to do. And if they get going on something like this, maybe that does provide is an easy way to transition those patients to a more traditional in-person program. Once we're on the other side of this pandemic, then maybe that's when you could do more traditional program, especially if they are higher risk. We do believe that, in the future, patients are going to be more and more comfortable with virtual treatment. And maybe it's not totally virtual, but this is kind of the way of the future. Why not test the waters now? We did talk a little bit here about scheduling. We talked about this before, scheduling regular outgoing messages to outreach to patient leads. I mean, you can do this with your existing patients, but it's still going to be important that you nurture these leads. If people are saying, I'm interested in weight loss, maybe I don't want to do it right now, I'm too stressed out, but as soon as this madness is over, I want to do it. Don't just let them go and call them back in a month, 2 months, 3 months, however long this takes. Yet kind of just reach out to them by sending some outgoing messages and nurture them. Remember, stimuli narrowing right now. If they're working from home, the stay-at-home is in their area, the stimuli are gone by the nature of the situation. So it does make things a little bit easier in that respect for weight loss for patients. And they're not traveling, they're not attending the food-based events. Maybe they have more time for cooking healthy. Virtual group sessions, I think, can be a positive way for people to interact when they're at stay-at-home quarantine situations to interact with more people if you're doing this virtually. So that could be a positive thing. And like we already mentioned, more time to exercise for some people, and especially if exercise at home. So those are messages, outgoing messages that you may want to solidify or just bring awareness to with folks that may already be kind of thinking maybe this is a good time, and just confirm, yeah, for some people it is. It's a really good time, and you become engaged, and maybe we could do this, virtually right now if it's really going to be difficult for patients to come into your clinic. Okay, wrapping things up here. Resources. I mentioned just previously, we did do a national webinar yesterday. I'm recording this on April 9th. So April 8th, we did the national webinar, setting up a telemedicine program in a pandemic with Dr. Ziltzer. Here's the link to the recording of that you can access, and I can get you this as a hyperlink. So you can go back and look at it. Great information. Went to more detail on what an actual clinic is doing, how they're doing it, how they're handling medical monitoring, labs, why this may be a good time for some patients. Weighing the benefits from getting people involved in treatment now, and if they're comfortable coming to the clinic, if you're comfortable with that, why, the benefits of that versus, a patient not doing weight loss right now or gaining a bunch of weight. So it was really good. There is an AMA quick guide to telemedicine in practice that I will get you the hyperlink to. And there's a number of OptiFast clinic Facebook sites that do a really good job. We talked about that outgoing social media messaging to patients to keep them engaged, to keep them interested in maybe starting a program. So these are all hyperlinks to Facebook pages from Central Ohio Nutrition Center in Columbus, Ohio, MedFit in Denver, Colorado, and Scottsdale Weight Loss in Arizona do a great job. So just to give you some ideas of what could be done. There's also the Obesity Action Coalition, the OAC. They have got a page with some really good community news and resources for healthcare professionals. So we have that hyperlink there. And what I may do is send you copies of these slides where these hyperlinks are active. If you're watching this video right now, you can't click on them, but I'll send a PDF of the slides out too that have the hyperlinks. So thank you for hope it was helpful. Please reach out if you have questions on any of this information, and look for upcoming emails from me on upcoming webinars. We're doing a series of regional webinars that I'll personally be conducting, and we're doing more national things. So we'll keep you updated on all that stuff. Thanks again.